So I can see attendees just starting to join now. We'll give everyone just a minute or so to get in, and then we'll get started. I think that's everyone that was in the waiting room now been able to join us. And there might be some more people joining the next few minutes, but that's no problem at all. So, good afternoon, everyone, and thank you very much for making time to be with us today. If you're watching this live or taking time to view this after the event via our YouTube page and website. My name is Jill Will, and I'm the healthcare specialist with Scleroderma and Raynaud UK, and I'll be your host for today. We're delighted to welcome you to this webinar on sleep. It's such an important topic for everyone, really, isn't it? We all need our sleep. So today, our guest speaker is Dr. Simone Battista. Simone is a physiotherapist by trade and holds the post of research fellow at the University of Salford, as well as being an affiliated researcher at the Lund University in Sweden. Simone has undertaken lots of study, including a master's in rheumatic and musculoskeletal rehabilitation, and very impressively, a dual PhD in neurosciences and medical science. Simone's research has focused on understanding the many factors that impact the lives of people with rheumatic and musculoskeletal diseases. Simone has presented his work globally, and I had the privilege of hearing him speak at the latter part of last year at an online conference on the subject of sleep. And I was really captured by what he shared and how he put the message across, and thought it would be wonderful to have him with us for a webinar. So I'm delighted that today's the day that is happening. And Simone's going to be sharing some tips on how we might improve our sleep. We have asked for questions beforehand, and we were delighted actually that when Simone shared slides with us earlier this week, quite a number of those are addressed in what we had already planned to deliver today. So there's about 6 questions I think we're already kind of taken care of. We have got some already that we'll go to at the end of the session. You should see a Q&A box on your screen, so please do feel free to make use of that if there's something that you want to know more about, or there's a particular question comes up for you. We might have to reframe your question just slightly to protect your anonymity, given that this is recorded and will be shared on YouTube, and we'll try and get through as many of the questions as we can at the end. So thank you very much for being here with us. Thank you, Simone, for all the time and effort that you've put into preparing for today, as well as giving us your time this afternoon. So the floor is yours. Thank you.
Thank you so much, Jill, for the kind introduction. It's a pleasure for me to be here today with all of you and to speak about a very important topic for me, which is sleep. And first of all, happy World Sleep Day to everyone. And it was nice to have this presentation during this day. And as mentioned by Jill, I'm going to focus a bit about the link between scleroderma and sleep. And then we're going to see some practical tips on how people with scleroderma can increase the quality of their sleep. So what's on the menu for today? We're going to start by seeing what is sleep and why do we sleep? Why sleep is such an important thing that each of us do every day? Because if you think of it, 1/3 of our life normally is spent sleeping. So why sleep is much important for human beings? And why do sleep problems happen in scleroderma and what you can do to try to improve it? And we're going to also see some of the common sleep disorders that some of you might have that might be or not related to scleroderma, so that if you find yourself in one of those, then you might ask the GP if you can then have a diagnosis and then receive proper treatments. And of course, we're going to see some practical ways to improve sleep. Let me start by providing you with how neuroscientists define sleep. As you can see for this definition, it's actually quite boring because basically it says that during sleep, we fall into an active state of unconsciousness, and the brain is also in a relative rest mode and is mainly reactive to internal stimulus, which mainly are dreams. But sleep is much more than this. Because sleep is not just rest. During sleep, the body actively regulates inflammation and pain. And as you know, systemic sclerosis is an inflammatory and connective tissue disease. So sleep quality can significantly improve how you feel every day. And when we think about sleep, we often hear vague explanation like rest, recovery, but for people with scleroderma and other rheumatic condition, sleep plays a very specific biological role. First, deep sleep is when the body performs most of its tissue repair. Some hormones like the growth one increase, there is a cellular turnover, and so the connected tissue, muscles, and joint undergo essential maintenance. And as you can imagine, this matters enormously for people with pain or inflammation. Then sleep is one of the strongest anti-inflammatory regulators available for human beings. During good sleep quality, the levels of inflammation drop. So when sleep is disturbed, inflammation levels rise, driving disease activity. But also sleep is deeply tied to immune function. Poor sleep is essentially a form of immune dysregulation. And also, good sleep helps regulate pain processing in the nervous system. I guess it can happen to each of us. If we don't have like a nice night of sleep, we feel more pain in our body. And this is normal, happen to everyone. But if you have already some pain because of a condition, then this pain increases even more. Because basically our pain threshold lowers. And finally, poor sleep is very important for our emotional regulation, memory, and concentration. We're going to talk in a second about the so-called REM sleep, which is the right eye movement sleep, which is a phase we're going to dig into in a second. But this phase where we mostly dream, this is where the regulation of emotion and stress happen. So for people with scleroderma, sleep isn't just a lifestyle factor. It is a core biological process that can influence immunity, pain perception, and overall disease control. But how does sleep achieve all of that? Sleep is not one continuous state where the body simply switches off. Instead, sleep is structured into different stages, and each stage has a different role in helping the body recover and function properly. The first stage, where we spend up to 15 or 25% of our night sleep, is called deep sleep. During deep sleep, the body focuses on physical restoration, the muscle relax deeply, movement is minimal, and the body directs energy towards repairing tissue, supporting the immune system, and reducing inflammation. As you can imagine, this stage is particularly important for those whose disease involve muscles, joint, or connective tissue. Another important stage, which I mentioned briefly before, is called the rapid eye movement sleep, which take up to 25% of the night. And during REM sleep, the brain is actually quite active. We have a very high activation of the brain. And this is why most of the dreams occurs. So the muscles of the body are temporarily relaxed. There is a total shutdown of the body. And why? Because as you can imagine, we don't want to physically act out during our dreams. And REM sleep is important in emotional regulation, memory processing, and in regulated how we perceive sleep. Then another important part is the light sleep, which is actually most of the night. And this part is also very important because it helps the body to transition between one phase and the other. And during this time, the heart rate, breathing, and other autoimmune function become more stable, so that the body prepares to move into the deepest sleep cycles. And another important thing that happen is just sometimes we do wake up during the night. We might notice, we might not. And this is absolutely normal if it's less than 30 minutes a night. If it's more, this can become a problem. Why our brain do that? Because from an evolutionary point of view, you can imagine that basically not have any kind of consciousness of what happened externally for 8 hours can be threatening. So sometimes the brain switch on, check the situation, if everything is safe, and then goes back to sleep. And again, we might or might not notice that. Another important thing is that we don't go through these stages just once. Instead, we cycle through them repeatedly during the night, usually about 4 to 6 times. And each cycle lasts approximately 1 hour and a half. So this is why fragmented sleep can be so disrupted. If something wakes up frequently, like pain, reflux, breathing problems, Raynaud attack, and so on, then the body may not complete these cycles properly. And we might not get enough of the deeper restorative stages of sleep that we need. So try to think sleep like a washing machine cycle. Each stage does a different job: repair, emotional regulation, body regulation. If the cycle keeps getting interrupted, then the body never finishes this program. So good sleep quality means cycling through all these stages several times per night. But I'm going to explain in a second that there are a moment during the night where the cycle is more focused on the deep sleep. And this is the very beginning when we fall asleep. Instead, the later stage of the night is more focused on REM sleep. And why this is important? Because of the circadian rhythm. Because our circadian rhythm doesn't care what sleep stages we want. It follows its own schedule. It's regulated by another part of the brain. And deep sleep is programmed to happen early in the night. Instead, REM sleep is backloaded. It normally happens late in the night. And again, this time is controlled by our internal clock, not by how many hours you plan to sleep or what you think your body needs. So if you wake up earlier than you are supposed to, you're not giving enough REM sleep. You're going to lose it. And if you go to bed too late, your body doesn't shift the deep sleep later. You just lose deep sleep. Try to think of it, and this is quite a nice metaphor in the UK, like a train timetable. These trains are always punctual. Deep Sleep Express leaves early, the REM Express arrives late. And if you miss them, they don't come back just because we want to. So we can't choose the stages, our biology does. And remember that not everyone fit those exact clock times. There are some people who are defined as early birds, or some people like me who are defined like night owls. What does it mean? Is that my circadian rhythm is a bit pushed later during the night. That's why I work better during the late hours. Instead, I can't function at all. That's why I was very happy when they provided me with this time to do the meeting and not early in the morning, because I can't function. What does it mean? Is that if we know what is how our clock time works, then we should adapt as much as we can and appreciate that sometimes life can't fit into that. We should fit our life based on our chronotype. And this is why consistent sleep timing matters so much. You are trying to work with your biology, and you can't negotiate it. So let's now focus on what happens in scleroderma. We know that most of the people with this condition report poor quality sleep, and many people experience insomnia, frequent awakenings, and fatigue. And I can imagine that if some of you are here today, is that you might fit into this category. But I'll try also to give a positive message, is that if we understand very well how sleep works, then we can manage it and we can improve our quality of life. So why scleroderma can affect sleep? And again, this might resonate with your own experience. Because a lot of people with this condition notice that their sleep becomes more difficult. And usually this isn't caused by one single thing. It's often a combination of symptoms related to the condition that lead then to a low quality and frequent awakenings during the night. One of the most common is pain, and this can be due to arthritis, distal ulcers, and so on. Because joint pain, stiffness in the finger or in the other joint can make it difficult to get comfortable at night, but also wake up during the night if we have a flare-up, not allowing for that sleep cycles that we mentioned. Then heartburn is another common one, because as you know, the esophagus doesn't move the food very effectively. So that's the stomach acid come upward during the night whilst we are lying. And this lead to heartburn that again can wake us up during the night. Then also the gastrointestinal involvement, and this can be to diarrhea, bloating, fecal incontinence, and constipation, which can happen in scleroderma. Another important one is fatigue, itching, which again can make it harder to fall asleep or stay asleep. We're gonna also have a look at the breathing problems, which play a very important role because this can lead to shortness of breath and disturbed sleep. And sleep apnea is another very frequent condition with scleroderma. Basically when breathing stops briefly during the sleep and cause the repeated awakenings and a typical morning headache. And also Raynaud's attack that can occur during the night. And sometimes some types of medication, like steroids, can interfere with the sleep. So if we all put this together, it's easy to see how sleep can become fragmented, and this fragmentation prevents the body from getting enough deep or REM sleep, as we discuss later. However, as I said again, sleep problems are often manageable once we identify the underlying cause. Let's see now some practical tips. For each of the problems that I showed, I'm going to give you some practical tips on how to deal with them. So when it comes to pain, an idea can be to use extra pillows, conscious, have a good mattress that can support the painful joints. And also it's useful to keep the hands warm, like using gloves, warm water before bed, and so on. And try to discuss with your GP or your rheumatologist when you can take some medication. If you notice that some of them might disrupt your sleep, maybe you can discuss to get them earlier during the day. And this is, of course, difficult if you're sleeping, but try to avoid the long periods in one single position during the night. And another good things that you can do is try to do some gentle movement, breathing, relaxation for the body before going to sleep. Heartburn, again, is a very common, and there are a few stuff that you can do. The first one is try to have one of those beds that you can incline or use more pillows so that you have elevated the head of the body. If you can, and this is good for everyone, not only for people with scleroderma, but try to avoid eating 2-3 hours before bedtime, because this also can impact your heart rate variability, which we want to have it low while sleeping. There are some food that I'm quite sure you know that can trigger heartburn, like fatty foods, so things that are fried with oils, chocolate, and alcohol. And also alcohol can impact REM sleep. It tends to reduce REM sleeps. So if we think that we might sleep better because of the effect of the alcohol, but actually the quality is lower. A good thing is to try to sleep on the left side. It decreases the heartburn. And there are some medication that you can discuss with your GP. A brief things that I want to say is that I'm not a medical doctor, I'm a physiotherapist, so it's not my role to prescribe medication. I'm just providing you with some references so that then you might discuss with your GP or rheumatologist. There are some drugs that reduce heartburn, like acid reducing medication. Alginate seems to be a good one and has less side effect because it forms basically a protective barriers that help the acid from going upward. And also it seems that some patients benefit from medication that improve gut movement because it also improves the mobility in the stomach of the food. If you have gastrointestinal symptoms, a few things that you can do is try to eat smaller evening meals and avoid gas-producing foods at night. That can increase the feeling of being bloated. Maintain regular bowel routines. This is very important, not only the sleep timing, but also the food timing. So try to have breakfast, lunch, dinner, always at the same time. In creating a routine in our body so that our body already knows that he's gonna digest the food by that hours, more or less, and is preparing before some biological process to digest the food better later. Another good thing is try to avoid caffeine after 2 p.m. Caffeine has a lot of positive effects, is a good antioxidant, but it impacts quite a lot the times of your deep sleep. And our body needs 7 to 9 hours to wash out caffeine. So if you get late during the day, then your deep sleep will be affected. And also try to discuss treatments for motility or bloating with your doctor. When it comes to fatigue and itching, gentle daytime activity helps reduce fatigue. I know it might sound controversial, but gentle physical activity throughout the day and try to avoid as much as possible sedentary behavior, in the end, tend to reduce fatigue. Skin hydration is very important, so hydrate your skin before going to sleep. Again, regular sleep schedule, and try to choose soft bedding to reduce the pressure on your skin. When it comes to breathing problems, I'm quite sure that each of you has already assessed if they have any complication on their lungs. If not, it's good to do it. There might be some oxygen or respiratory treatments that the doctor can prescribe. And try to think about some sleep position adjustment. So try to find a position where you feel that you are sleeping better. For those of you that then develop apnea, and with apnea, we mean when basically your breathing stops repeatedly for like a few minutes during the night. How do you know that if you have it? Mostly it's your partners, if you have one, that tell you because it's snoring and choking, the first two symptoms during the night. But there are some self-reported symptoms like morning headaches. So you wake up and you're feeling like a strong headache. This can be because the oxygen in your brain was lower because of apnea during the night, and also daytime sleepiness. And this comorbidity is very common. Around 1/3 of people with scleroderma have it. And it's usually multifactorial and not purely anatomical airway tightening. And the possible mechanisms can be interstitial lung disease, pulmonary hypertension, heartburn, airway inflammation or some edema, reduced lung compliance, and other reasons that might or might not be related to scleroderma, like obesity. And if you have any of them, the first line intervention is the one that I'm showing you in the pictures, which is the continuous positive airway pressure. And these treatments make such an improvement in sleep apnea, so that I know it's not nice to sleep all night with a mask, but if you have sleep apnea, try to consider this intervention. What shall we do when we have Raynaud attack? This goes a bit against the general sleep hygiene recommendation that the general population should adopt, because normally we suggest to keep the bedroom cool, because cooler temperature can help the body fall asleep easily. And this is actually why when we take like a very hot shower during the night, we feel we sleep better. Some of us think that is because our body is more relaxed, but actually once we go out of the shower, the drop in the temperature, it's a signal for our body to start falling asleep. However, for people who have Raynaud's phenomena, very cold temperature can trigger attacks in the fingers or toes. So here the goal is to find a balance. So the room should be comfortable for sleep, but not so cold to trigger symptoms. Some practical things that can help include keeping the bedroom comfortable, cool, rather than cold. Wearing warm socks or warming the hands and feet just before going to bed. And also some people find that warming the bed before sleep helps prevent nighttime attack. So here are just recommendations. You need to find your own solution. But in general, the important sleep advice is to adjust it, basically your room based on your own needs. And again, another important factor to discuss with your medical doctor is the medication effect. Because we know that some medication used to treat autoimmune condition can influence sleep patterns. As I mentioned before, steroids is one of them because it makes people feel more alert or restless, particularly if they're taken later in the day. So if you feel that this medication might be affecting your sleep, try to discuss with your doctor. Of course, don't stop or change by yourself. Because sometimes a simple adjustment, like taking the medication early in the day, can make such a big difference. Another important thing that I would like to discuss with you, because they're getting quite common, is sleeping tablets. Because in some cases, they can be helpful, particularly with a diagnosis of insomnia very severe. However, in conditions like scleroderma, sleep problems are often caused by other symptoms, such as heartburn, pain, and so on. So these tablets won't help you if you don't solve the problems that we mentioned earlier. So the most effective approach here is to treat those problems earlier and see how sleep change. Sometimes sleep medication can be used for short periods, but they should always be discussed carefully with your doctor. Another very popular option that I would like to discuss with you is melatonin. A lot of people are taking it, but you have to think that melatonin is an hormone. It's not like a dietary supplement. How does it work? It works on the circadian rhythm that we mentioned before, because it helps regulate our own body's internal sleep-wake rhythm. So for those who have difficulty falling asleep, or those that have problem in sleep timing, like after jet lag, melatonin can have an effect, but not when sleep is disrupted by other condition. And again, it should be taken following your medical doctor advice. So the key message here is that if sleep problems start after a medication change, or if sleep remains difficult despite other strategies, it's always worth reviewing this with your healthcare team to see if medication adjustment can help. And now I'm going to walk you through some of the core sleep hygiene recommendations that everyone should adopt, because these can be helpful alongside all the things that we have said. And these are general good habits that can support sleep, and they are generally called sleep hygiene recommendation. The first one is try to keep a consistent sleep schedule. Going to bed and waking up at roughly the same times can be very good for our body, even during the weekend. Even if you can't for some reason during the week, the so-called catch-up sleep during the weekend is also good and beneficial. And another important thing that a lot of people ask me is how many hours of sleep should I take? We generally recommend 7 as a minimum. 8 is the correct numbers for most people. It's also fundamental, above all in our world where we have a lot of triggers, emails, telephone, WhatsApp. We are always doing something to create some wind down routine before bedtime. These allow sometimes for the body and mind to relax before sleep, rather than going straight from busy activities to the bed, because otherwise it's going to be very difficult to sleep. How to do that? Mindfulness meditation are very good. Some gentle movement or other mind-body practice like gentle yoga, all of this stuff. Reading a book, potentially not on an iPad, is another good things that you can do. And as I mentioned before, we need to optimize the sleep environment. As I said, sleep should be in a cool temperature, but also dark, quiet, and comfortable. And another important thing is light. All the blue light interfere with deep sleep. they're basically saying to the body, like, the sun is still out, you don't need to go to sleep. So try to have some adjustment. Try not to use, if you can, an hour before going to sleep a screen, or if you must, there are now a lot of options that make the screen less brighter and more yellow. And these are night shift programs that you can have installed in your telephone and so on. Try to limit caffeine after lunch and reduce alcohol in the evening for the things that we said. The first one impact hugely on the deep sleep, the second one on your REM sleep. I've already mentioned before, but I like to reiterate it. Some screen-free time, any blue screen, 1 hour before going to sleep is very good. Our warm bath or shower is also good for the reason that I mentioned before, because of the drop temperature once we go out of the shower, this signal to our body, now it's time to go to sleep. During the day, regular physical activity and tackling sedentary behavior is very important, both for sleep, fatigue, and so on. Ideally, try to avoid vigorous exercise late in the day, unless it's the only possibility you have. So better to do some physical activity even late during the night than not doing anything. Another trick is morning light exposure. The first things when you wake up, open the windows, the curtains, and triggers your brain with some light exposure, as much as we can get here. And try to evaluate comorbid sleep disorders early. So discuss them with your medical doctors. And another important thing that to me is fundamental, I was very happy when I discovered it as a researcher, is that short naps right after lunch are beneficial. Our brain is programmed to have those naps because it's called binaural sleep. So we should have our night sleep and then a good nap, short one, not too long, right before lunch is beneficial. Alongside sleep habits and managing symptoms, there are several behavioral approaches that can significantly improve sleep. The most effective one, if you have a diagnosis of insomnia, is called cognitive behavioral therapy for insomnia. This is the first line recommended intervention for chronic insomnia, which is an insomnia that lasts for more than 3 months. And everyone with insomnia should receive it. There is also an NHS app, which is called Sleepio, that you can download for free and use it. And if you have chronic insomnia, there are no sleep tablets, nothing that can work if you don't also do CBTI. Also, mind-body approaches like yoga, breathing relaxation technique show some benefit, and they're good to be done before going to sleep. Again, I'm a bit biased because I'm a physio, but exercise and physical activity in general shown to improve sleep quality, and people tend to fall asleep more easily. For each of you, this might mean gentle or moderate activity, something that you like, that is meaningful for you, that is comfortable and appropriate for you. If sleep problems continues despite those strategies, it may be helpful to speak with a sleep specialist or your GP or rheumatologist, because sometimes there might be another sleep condition involved, which may need specific evaluation and treatments. And this is why I thought that to conclude our talk, I'm going to just mention briefly some of the main sleep disturbances, so that if you think you end up in one of those categories, then it might be worth talking to your doctor. The first group, and is the most prevalent one, is insomnia. With the term insomnia, we mean a difficulty in falling or staying asleep. If this happened more than 3 times a week for 3 months, there is a diagnosis of chronic insomnia. And the diagnosis is purely clinical. You don't need to do any exams other than that. Then you're basically your story. Then there are some problems that can lead to fragmented or non-restorative sleep. And these are also very common in rheumatology in general. So people say, this is what you might notice, I slept enough hours, but still I woke up exhausted. In these cases, sleep quantity might look normal, but the quality is impaired. Why? Pain, inflammation, medication, all of this can be fragmented, which increase then the next pain sensitivity and fatigue. Here is good to have an exam which is called the polysomnography. I've mentioned before the sleep disorder briefing, like snoring, sleep apnea, hypopnea, and this, again, it needs to be diagnosed objectively, like with a polysomnography, or there are some home sleep apnea tests that you can also do. Another very common is the movement disorders, which are well known, like restless leg syndrome and periodic limb movement. This again is diagnosed mainly clinically based on the story. People notice that they can't stop moving their legs during the night, or they have the feelings and the urge of move them. In those cases, however, the polysomnography is very useful to quantify the leg movements. For those of you who don't know it, polysomnography, you go to the hospital, they put some electrodes all along your body, and then you sleep there. And then they see how the brain works during the night, how your body works during the night, and then they can make your diagnosis. Then the last group is the parasomnia, like sleepwalking or REM behavior disorders. So we said before that during REM, our bodies should shut down. There shouldn't be any movement because we don't want to act out during dreams. However, sometimes this is impaired and people start moving even during REM sleep. Again, this required polysomnography. So we're almost at the end before your question, and I would like to give you some takeaway messages. So the first one is that sleep problems affect more than half of people with scleroderma. And some drivers that we saw together, right? Reflux, pain, pulmonary disease, sleep apnea. And it's important to addressing the underlying symptoms so that we can then improve sleep habits. The good news is that many of these problems are treatable or manageable once we understand what is causing them. That is why important for people who have sleep issues to discuss routinely. And also in general for all of you to discuss that with your rheumatologist during your scleroderma care. With the right strategies and support from healthcare professionals, many people can significantly improve their sleep and overall quality of life. Thank you so much for listening to me. I hope this was useful. And of course, I'm here if you have any question. Thank you.
Brilliant. Thank you so much, Simone. There's lots there that was very helpful. As you've indicated, we have got time for questions. So if anyone has any questions at this point, there's not a raise hand function, but there is a question and answer box on your screen there. So feel free to drop any questions in there. And we did receive some beforehand, so I'll fire away with those just to get it started. So the first question is about elevated heart rate during sleep and whether that's common in systemic sclerosis or scleroderma, and equally is that common in the general population?
So thank you so much for this question. And the answer, the briefly one is yes. So autonomic dysfunction, such as an increase in heart rate, is very well documented in systemic sclerosis. And this, of course, can enhance the heart rate regulation, which we saw is very important during the sleep. But also, sleeping well can decrease heart rate. So that's why monitoring both of them is very important. The reason for this, we know there can be like some form of pulmonary hypertension, myocardial fibrosis, or hypoxia from sleep apnea. That's why treating all of this is very important, because in clinics we can see like higher resting heart rate, reduced heart rate variability. So, and this can also be monitored by wearable trackers. So you also have some evidence to show to your healthcare providers that this is happening if you wear any of them, but sometimes you also feel it. because of palpitation and other stuff. So again, it's normal and sleep can help with that.
Great. And actually, you just touched on a question I had personally was, lots of people wear smart watches or use apps on their phone, particularly if they suspect some issue around their sleep. So how helpful is that information for the healthcare teams that are supporting that person?
So, I don't want to disclose or make any ad. For instance, I'm using a smart ring to measure my sleep every day. They have done a few studies comparing smartwatch and smart ring against the polysomnography, and they are quite good. There is like an agreement of 70 to 80% that, if you think of it, is quite a good percentage for such a small device compared to the whole polysomnography, which is basically a whole lab. And also these allow us to monitor every day, because polysomnography is a beautiful test. It's very fascinating from a neuroscientific point of view. But I appreciate that going to sleep in a hospital with all the devices on your head can also be sometimes not very comfortable. So these devices can be very useful, and some of them also provide ad hoc strategies to improve the sleep.
Right. Super. So anyone who's thinking about going to their doctor off the back of this, who happens to be wearing any kind of device, maybe have a look at their sleep information and think about showing that to their doctor then. I was delighted when you said that naps can be helpful as well. Have you got any kind of guidance around what makes a good nap around lunchtime, or what we should and shouldn't do for those short spells of sleep?
So, Jill, if I got it correctly, which kind of things we should or should not do before going to sleep? Was that one the
Yeah,
question?
for you mentioned naps, so having a short sleep at lunchtime. Um, what
Spanish
should
people know very
we
well.
do?
Yeah, so one thing that I want to say about nap is very important to keep it short, because then if you sleep too much, this can impact then your late sleep. And also, that's why it's recommended after lunch and not late, because if you have like a nap at 8 p.m., this can of course then impact your sleep. But two very important things that I like to reiterate is that the screen time, because of two reasons, like emails, WhatsApp, all these things can trigger us to do something, and they make our brain works, and also the screen themselves. So this, and some things like relaxation, breathing exercise, this can make a huge impact in the quality of our sleep.
Great. And I think probably our final question is about how you might go about differentiating between a sleep disorder that's related to scleroderma versus one that's potentially associated with perimenopause or menopause.
So this is another very important clinical overlap that sometimes can happen. I've shown before the main reasons that are strictly related to scleroderma, like reflux, dyspnea, chronic pain, Raynaud, and so on. But there are a few things that are more typical of menopause or perimenopause, like hot flashes. Night sweat is another typical one that make you think, okay, maybe this is menopause or perimenopausal symptoms and not the scleroderma. Also, the early morning awakening is more typical of menopause. And if you have insomnia, but no any other triggers. So if you start feeling insomnia and you say, oh, I don't have most of the problems that we mentioned, there is no anxiety, no depression and other problems, then maybe this can be a good one. Of course, hot flashes are the main typical of menopause, reflux, dyspnea, more on scleroderma. There are also some questionnaires like the menopause rating scale that can help in differentiate and see the impact of this. But sometimes they happen simultaneously, and these make the diagnosis more difficult.
So sometimes it's a bit of trial and error, is it, to see what might help. And I guess maybe do you think it's about trying one thing for a few nights to see if it helps and then add something else in, maybe rather, sometimes when we think about trying to fix something in our lives, we can feel overwhelmed thinking, oh, I need to do this and this and this and this and that. Do you think adding one thing for a few nights and then another might be a helpful way to approach it?
This is a very important thing to think about because today I have reported in a very schematic ways and it seems simple, but then reality is much more complex. Some problems may overlap with one another. So sometimes try, see if it makes changes and then try again is the best solution. And we normally, like myself, I'm one of those person, if I heard like this presentation 10 years ago, I will go and change all the furniture in my rooms, change all my schedule. But
Yeah.
sometimes this is not like the best approach because in the end, you don't know which is making the differences. So if you say, okay, tonight, let's try to increase the height of the neck during sleep and let's see if it make a change. If it does, then try to add something else. If it doesn't, avoid that one and then try something else. Because our body are complex, our mind are complex. So, and these are complex problems that need complex solution. But we can try to simplify it by adding one after the other. But again, it depends on the person. Like, as I said, I'm giving this advice by one of those that would completely change my life just by a 30 minutes presentation. So
Brilliant. Thank you so much. I think that's all that we've got time for this afternoon. And thank you everyone for being here with us or for watching this back. But huge thank you, Simone, for your time and effort and helping us all to have a better night's sleep going forward. It's much appreciated and happy World Sleep Day to everyone. I hope that you do sleep well tonight when the time comes. We've got details on our website for our programme of webinars. We'd love to hear what you thought about the webinars. If you're watching this back and you've got comments or questions, please feel free to use the space on YouTube to post those as well. And we look forward to hopefully seeing you at another webinar again in the not too distant future. I think our next one is looking at foot health. So again, one that's probably quite close to your heart as well, I would imagine, as a physio. But often overlooked. So we're very much looking forward to that. That'll be on the 1st of April. So keep an eye out for the details of that. Thank you very much, everyone. Enjoy the rest of your afternoon. Bye.
thank you so much.
Bye.